I just wondered if you got any reflections on that slightly weird imbalance.
Yes, I mean, I think by implication from what I'm saying, the treatment has to be at a societal level. And you know, if we kind of go back into our food chains and the way that we deal with them, then by attempting to sort of cut off the head of the hydra in somebody that happens to be diabetic, but then pushing junk food because it's the way that we choose to sustain ourselves, then would seem to be quite ridiculous. Then I suppose the sugar tax, which is the government's primary intervention, it is a very sort of linear economic measure in order to tackle that. I know that there was great success in Maori communities of when an individual committed a crime, that the whole society was sort of deemed to be responsible, which I believe fit quite well with Maori culture, and so when interventions were made to try and reduce crime rates, then that was a very effective mechanism, which didn't work with Aboriginals. So it's and I'm probably actually using completely flawed definitions here, but I suppose it's interesting that there is this kind of this idea of, yes, we need to intervene with people collectively as groups, and actually, you know, if you kind of go out after SCiO and have 3 or 4 pints, then in terms of that calorific content, then you've already kind of more than doubled or tripled your 800 calorie allowance. So, you know, and how many of us within this room are going to be prepared to, you know, sit down and have a lime and soda as an alternative? So, you know, we've kind of clearly got these mechanisms of addiction quite well embedded into our society, and I suppose perhaps in terms of the interconnectedness of health, it's not just about how that manifests itself on the cost of healthcare, but actually why do we feel the need to consume through these patterns in the first place, which is kind of quite a quite a philosophical question, and I think we're probably seeing a sort of a separation of ourselves from natural environment as being a good example of that. So actually, you know, why do we not do activity anymore? If we sort of sit around, then what's the implication on the types of food that we eat if we don't really need to sustain our own bodies? So it's multiple and manifest. Yes, Benjamin.
Yeah. So, how, if at all, could we intervene in ecosystems without destroying them?
Ecosystems.
Well, talking about health of an ecosystem, a health ecosystem that's generated all of these long-term conditions, particularly diabetes being a quite nice example. Mm-hmm. So you're saying that the intervention has to take place on a systemic level. Most of what we know about how to sort of do interventions requires us first of all to organise and clarify and make legible what's there, and even that first step would tend to sort of destroy the ecosystemness of it.
So I think I'm disagreeing with both of those two statements. At a systemic level, I'm saying that you will not be able to see what the system is, hence the small arc of a larger circle. So we will never gain the 100% of the total system. I think that's a fallacy. And then the second being then to kind of to map and understand that in a legible way. I'm saying that the legibility again it is a convenient misnomer. So actually, if we look at Bromley by Bow, that's been there for, you know, from a health context at least 30 years, and actually has grown incrementally. The NHS actually tried to shut it down because their perspective was, well, why should communities be providing healthcare? That's what the NHS does. So actually the ability to be able to, I suppose, to take risks, recognise that we, even from a clinical perspective, are not separate from communities, and be able to sort of to take incremental movements and see what works, all of which are things that we need to be doing. But in terms of the metaphorical domain, which I'm kind of alluding to, I don't know actually. There are clearly other forms of description which we need to find, which we're not doing a very good job of finding, and I don't know what those things are.
I guess I'm asking, I agree. I guess I'm asking the question back to you really, because on the one hand you seem to be saying that sub-ecosystem interventions are inadequate, and on the other hand you're saying that that's the only possible type of intervention that we can make. So just think about the
okay, so and I think there's a distinction between top-down system intervention and community.
Right.
So I suspect that only by recognising and embracing community in all of its different connotations are we going to address this healthcare epidemic, and that by top-down systemic interventions a la NHS England's National Diabetes Prevention Programme will never work by virtue of the fact that they attempt to abstract measurement and objective value from the system in which it's embedded.
There's something about organicness, or there's a flavour of the type of thing that you would approve of as a possible intervention that you think might have some prospects, as opposed to there's a clear type that you think doesn't work.
There seems to be a sort of consistent theme of the organisations that have achieved orders of magnitude like 90% cost reductions in the services that they've provided, and none of them have started with cost as the primary motivator, which is clearly significant. And most of them talk about things like love, which Andreas Weber talks about as well. So it's kind of there is this kind of this slightly sickly sweet thing that we find difficult to recognise aspect, which we're doing a bad job of seeing. But within certain bounded systems, people seem able to have been able to propagate, and it seems to have been very kind of locality, community specific. And then the attempts to then extract that DNA and supplant it elsewhere consistently seems to have been ineffective. There was John, you had a question, and then there was a Bill question.
Yeah, I'm interested in the use of the word steersmanship. And from the perspective of the individual in the healthcare system, how do the individuals locate the steersman?
That's an excellent question. My view is that in order to achieve the change that's required, then patients need to become able to discern meaning. And that's unlikely to come from biometric data or numbers on a screen. So again, some of the better examples have recognised that members of the community are good at providing steersmanship. So you'll have go into your GP and somebody will proactively come and sort of grab you and say, "Gosh, you look like you might be about to become diabetic. Can you come and do some tests?" As opposed to this kind of abstracted idea of a sort of faceless entity then suggesting that to you in the post. But I also wonder then if as consultants, if that's what's implicit in this kind of practice-based description of SCiO as an organisation, whether that implies a different form of interaction. So not necessarily, I've got some kind of top-down corporate objectives and I need to apply those to a group of people, but actually, do I need to also reflect the long-standing needs of those people to the corporate objectives? So I suppose there's a kind of a dialogue implicit in, I think, the roles of people like ourselves, in which we need to learn to be able to talk not only as sort of in an abstracted systemic way, but also at a sort of at a peer-to-peer level with people who are not as fortunate as ourselves. So I think that's a big part of it. That doesn't sound like it answers your question.
I think you've got me a lot closer, thank you.
Okay. We can carry on. Bill and then Aidan, I think.
You mentioned the remarkable David Sigmund.
I did, and thank you for putting me in his direction.
People here won't know that David was awarded an annual prize for Positive Deviant of the Year. And I was delighted to to be judging positive deviance and awarding him that prize. He would embody a lot of what we're saying in the way he conducted his GP practice. It wasn't so admired by CQC, and he was closed down because of his positive deviancy. He lost his job, and the other people who worked with him in that practice. I'm trying as well as I can to support him in his continuing battle with the director of the GP inspection regime within CQC, and I've got all the correspondence between him and the inspector in my briefcase. The regulation process is a very linear process. We publish these standards. You've admitted that you departed from these standards. There's only one possible solution, and that is to conclude that you're a danger to patients, and you must be closed down forthwith. I haven't got a question, but I'm seeing a potential opportunity from the discussion we're having this morning to bring a different perspective to bear on David and people like David as part of a need to reform the regulation process and open up some of this thinking to people like Professor Field and the Common Select Committee that was part of this process too. So perhaps we can have more of a conversation around this, but since you've mentioned David Sigmund there, I thought I would just let people here know that there's a lot going on and a lot of other GPs who are suffering in the same way but are too frightened to voice their concerns about the direction of travel.
Yes, yes, yeah, absolutely. And by way of a brief response, whilst working in part of the NHS, we had offered to use analytics to look at adherence to CQC guidelines in GP practices. So you actually look at, well, is the measure what it is reported to be, or is the measure what it actually is? And in most cases, it was turned down by commissioning groups on account of the fact that they didn't feel able to take action if they knew. So they were kind of saying, actually, we probably estimate behind closed doors that we've got 50% non-adherence to NICE, the clinical excellence type 2 diabetes guidelines. So we know that we're not providing the right level of care. We just don't want to be able to measure it, because then we'd have to do something about it. And of course, and so there's this kind of disparity between that and what you're saying, where somebody's saying, actually, the system doesn't work, I'm going to do something deliberately different. Well, then I'm kind of putting my head above the parapet and saying, yeah, exactly, yeah. So, but there's a huge dichotomy in those two positions.
Absolutely.
Yeah. I think that's probably a better articulation than I gave in terms of what is the role of the steward in this scenario. Aidan is at 5. Yeah, 5. Okay, got a couple of minutes.
Following on from Benjamin a bit, just to say something about our microbiotic environment, because I think part of what you're saying about ecosystems is there's some respect due in places that we don't even know the thing that we're supposed to be respecting. So my understanding is our gut biomes are so damaged that we can't reconstruct what a healthy one looks like.
Yeah.
That's across the whole globe. We're just late on to these things. So if we saw ourselves as sitting in a sea of bacteria and viruses and fungi and whatever that needed to be in balance with each other in order for us to be healthy, that's one thing. What we actually do is straight in there with the antibiotics and whatever to kill the bug that's making us ill, which is just a sign of the imbalance and making the imbalance worse. And that seems to me to be a lovely metaphor of where we are with healthcare. We pile in, chasing something, and create all sorts of effects that we can't imagine the larger circles and the small arcs. And I like both the stuff about bacteria and as a metaphor for where we are with healthcare. And it seems to be fundamentally about respect and not assuming that something we don't understand yet is useless, which is where we go every time. This is not necessary. We can cut this bit out because it doesn't do anything useful, like your baby milk example. And then every time we find out it's absolutely vital in the way that we have understood it.
Yes, absolutely. So you think we might learn from that and think, well, actually, if it's not broken, why not leave it there? Yes. Yeah, John. Are we 2 minutes?
Do you want to start? If we can, because we're slightly over time.
Okay.
So.
Do you want to make say quickly or?
You were talking about, quite right. To intervene in the system, you need multiple systems intervention and not centralised command and control intervention. Okay, right. Then you talk about these community groups doing things, but to what extent are they systems-oriented intervention? Now, we take this to the degrowth area, which is essential for the survival of the planet. Then the degrowth communities, right, transition towns and so on, deal with bits, but they don't see one of the central determinants of why we're all going the wrong way, which has to do with continuous creation and reproduction of hierarchy. So you get all the time an inability to see some of the major constraints on how the system operates and address systems interventions that will address some of those major constraints. So the question is it likely that these community interventions will, in some sense, add up to tackling these wider systems constraints?
I'll do a very, very quick response. I mean, ultimately, from a logical perspective, I cannot see how humankind is in any way sustainable. Most predictions seem to suggest that actually
We have to destroy the planet.
we're either going to destroy the planet or we will. Yeah, possibly. Maybe that. Yes.
To run down hidden resources that have been hidden away in the soil by Gaia.
Yeah.
To expose them and destroy them and thus destroy.
Absolutely. Yeah. So there's that, and then there's the, well, actually, do we need to be operating with a significantly lower population in order to be sustainable with much lower.
That wasn't my point.
No. So I suppose if you take it to its logical extrapolation, I think we kind of end up there. I don't know whether there's ever going to be all of these different communities adding up will equate to the 100% of what is required to achieve what is necessary for sustainability, for want of a better and less cliched term. But it does seem that emotional connectedness and feeling are missing components from what is required to enable that process to happen. The outcome of that, I don't know.
Thank you, Russell.